Hi there, my name is Jacob Robbins, and I'm going to talk with you about stress across the lifespan. I want to start by inviting you to imagine a clown. Imagine he's wearing a baggy silver silk suit with orange pom-poms running down the middle, and he has a collar ruff. His face is painted white, like his bald head, which has sprouts of orange hair around the sides, and grasped in his hand is a red balloon. He smiles, and his eyes glow embers of pale yellow. This is Pennywise. He is a shape-shifting clown from Stephen King's novel It, and he's going to serve as our metaphor for stress. And I chose Pennywise for a few reasons. First, we have to keep in mind that stress isn't inherently bad. It can motivate us, compel us, and keep us focused. However, when stress is outside our control or beyond our ability to cope, it can transform into negative stress and compromise our well being and our health. And this is the stress I'm going to be talking about. Another reason is that, like the shape shifting Pennywise can do, stress can also take on many different forms. And as we'll see, there are lots of different types of stress that vary in what causes them and how they can affect us. And um, Another reason is that Pennywise is perceived differently with age. So, in the story, the children who first encounter Pennywise in all his different forms return later as adults and face even more manifestations of him. And stress works kind of the same way, in that what it looks like and what it can do to us can change as we age. Finally, for the characters in the novel, Pennywise represented a challenge of knowing. Only after they learned more about Pennywise did they become better equipped to overcome him. And we'll consider stress in the same light as representing a challenge for science and a challenge for ourselves to learn about and overcome. So, we're going to talk about stress from three different viewpoints and try to answer three different questions here. The first is, what are the different forms of stress? How do they change across the life? And how can they be managed? And we're going to break these questions down into three parts each. So we're going to start with early life, then we're going to go talk about middle life, and end with later life. So first we have to define stress. So what exactly are we talking about when we're talking about negative stress here? Well, first, stress is the response of the body to any demand that increases arousal or alertness. Next, stress has to be aversive or unwanted. And another factor is uncontrollability. So stress has to feel like it's beyond our control. Distress is the emotional reaction whenever we experience a demand that does these things. And this can come in the form of pain, or feeling sad, or feeling anxious. So, what exactly happens when we encounter a stressor? So, we can imagine stress like a balloon, and that our body has elasticity. It can stretch or compress in response to a stressor before returning to its original shape, right? So when a challenge is experienced, we can cope with it and be able to return to homeostasis or our normal functioning. And if we experience a lot of stress, we can maybe change how we cope with it. We can change our coping ability. We can increase that elastic limit and it can be stretched further and still return back to normal. We can still bounce back from it. However, if we're pushed beyond our elastic limit, we can experience a breakdown in our ability to cope. And this is where the negative impacts of stress do their work. So now we're going to turn to those different types of stress that can do this. So there are a lot of different types of stress out there, but we can organize them by putting them on a continuum from event-based stressors to ongoing stress. So event-based stressors are things like major life change events. So major events, really memorable things that happen to us that result in some sort of change or that require us to adapt. Daily hassles or daily stressors are smaller, more day-to-day demands, but these things can pile up to cause stress and wear and tear on our well-being. Then finally, there's chronic stress, and this is ongoing, repetitive, serious stress that occurs and can compromise our health. And you'll notice also that there is trauma in the form of events and trauma in the form of chronic traumatic stress. And trauma is an emotional response to a terrible event like an accident or violence, and can have short or long-term effects ranging from shock to physical symptoms. So we'll talk more about how uh, trauma events and chronic traumatic stress differ across the lifespan as well. So now we've covered the different forms of stress, and we'll also consider from where stress can come from. And this can determine how often stress happens, how intense it is, and how well we can bounce back from it. So here we're looking at from where Pennywise emerges from, right? First is the individual level, which concerns what can happen within the person and between people. Above that is the community level. This refers to the family, the workplace, the school, or community at large. And by adding the community level, we can distinguish whether stress comes from a personal situation like physical illness or beyond that, like from neighborhood crime. And even above that is the regional level, which refers to political units like states, regions, and nations. And at this level, widely experienced events like single events such as 9/11 or ongoing events like recession can cause stress. So now we'll move on to our second question. How do these forms of stress occur across life? So, coming into the world as children and adolescents, we test reality and we learn the consequences of behavior. We construct predictability. So we're learning to trust our caregivers, our schools, or our own abilities. And it's here that Pennywise can be really devious by dismantling our certainty about the world that we're trying to develop. So, can I trust my caregiver or am I afraid? Will I be provided for or will I be hurt? Do I have the ability to overcome a challenge, or is it just easier to turn tail and run? So we're going to look at some of the opportunities Pennywise has to disrupt our interactions with the world and cause stress. In the first way, on the event side of things, in early life, can take the form of hospitalization or surgery, losing a loved one, or dealing with our parents' divorce. And these are associated with things like anxiety and behavior problems or trouble dealing with our emotions. When we're talking about daily hassles in early life, these can take the forms of poor grades or fights with siblings and are associated things like aggression and poor relationships. And when we're talking about that more serious, repetitive stress, this can take the form of bullying and victimization in childhood and adolescence. So this is repeated harassment from someone who's stronger and has control. And this is related to things like suicide in children and adolescents. Now, earlier we talked about trauma, so those terrible events that can produce short and long-term effects. And one of those uh, outcomes is post-traumatic stress disorder, which is an anxiety disorder that is characterized by intrusive thoughts about the trauma, isolation, and mood and mental problems. And about 1 in 6 children and adolescents develop PTSD after a trauma. But this is typically lower for non-interpersonal events like accidents, where it's a lot higher for things like physical violence. PTSD can lead to relationship problems, antisocial behavior, and delinquent tendencies. So earlier we discussed that stress not only occurs in different forms, but it also depends on where that comes from. And when we're talking about early life, we have to consider the role of individual and community factors. So children from disadvantaged communities might experience higher levels of those individual level stress, such as family tension, transportation problems, or parental unemployment. But also, poor living conditions can create uncertainties such as housing and relationship changes and family crises. And these stressors can pile up to create difficulties like regulating emotions, behavior problems in school, and general problem solving difficulties. As we transition into adulthood, Pennywise embeds himself into our newly found social roles. So he can strike out from things like our roles as a parent or our role as an employee in our careers. He can also emerge from chronic stressors like threatening neighborhoods or from ongoing trauma. And overall, these things can slowly drain our well being and our capacity to cope. And in particular, when we're talking about event stressors in middle life, we're seeing things like divorce, job loss, or having an abortion, which are related to depressed mood or physical symptoms like headache and trouble sleeping. And here in adulthood, daily hassles take the form of work-related ordeals, caring for others, or commuting. And this can have short-term impacts like feeling restless, or be more long-term like increasing the risk for depression. When we're talking about chronic stressors, again, we're looking at those social roles with things like overwhelming workloads or feeling a lack of control about one's job, or simply having to deal with unemployment and the resulting financial hardship. And this can be related with high blood pressure and immune problems, as well as poor memory and a lack of focus. In adulthood, the most common source of trauma is witnessing harm, experiencing accidents, or experiencing the unexpected death of a loved one. The risk for adulthood PTSD is highest after experiencing violence such as rape or physical abuse. And the impact here ranges from trouble with employment and marriage to planning your own behavior or using coping strategies to things like substance use disorders, anxiety, and suicide. And for adults who live in poor neighborhoods or living conditions, such as American minority groups, there is an increased risk of facing stressors coming from those regional and community levels. Things like outdated housing market policies that were based on segregation can have an effect from that regional and community level, or just a poor quality of one's neighborhood. Another example that really highlights how these levels are connected is is considering regional sources of stress for rural living communities or people like farmers. So when we're talking about a regional level event like drought that's widely experienced, when we're looking at rural dwelling individuals like farmers, they might already have work stress related to their jobs or to unemployment when things are really tough. And when you have a widely experienced event like drought, that can really worsen the already existing stress. In later life, Pennywise doesn't come around as much, but when he does, he often takes the form of loss, whether it's losing physical abilities, friends, or a spouse. But he can also still come back to haunt from early trauma, which can still reach far into older age. And indeed, middle life stressors like divorce or job loss are less common here, but are replaced by illness and physical disability, distress from losing a loved one or losing a home. And these are associated with things like higher risk for depression and alcohol abuse. And here, hassles related to home, work, and social domains also become less common. But it's important to note that the reaction to these stressors when they do happen isn't necessarily different from what it was like whenever people were younger. So we still see negative mood and physical reactions like headaches and chest pain, just as we did in earlier in life in adulthood. Chronic stress, such as financial and work stress or health-related stress, are the most common at this stage when we're talking about that ongoing form of stressors, with health and interpersonal being rated as the most threatening and associated with depression and drinking problems. And another source of stress is more social or community related. For example, older people may become distressed about the quality of their communities, and this can hurt their sense of safety, especially if they view familiar people leaving and strangers coming in. Trauma and PTSD is also less common here compared to earlier life stages, but like we mentioned from the outset, PTSD is more likely if trauma was experienced in earlier life rather than later. However, this doesn't negate the fact that trauma can still happen. So, for instance, after a physical illness or surgery or a severe fall, we can still see trauma symptoms develop. Furthermore, older individuals also present a unique set of trauma symptoms in addition to the normal symptoms. So things like cognitive problems and relationship problems also occur and are unique to older age trauma. Returning to the vertical context of stress, we can also consider the role of culture in older adult trauma. A 2009 paper by Strug and Associates examined trauma in older Hispanic adults, and they found that Poor Hispanic immigrants not only experience a lifetime of social and economic hardship, but that for the older adults, we're seeing worse psychological and physical functioning, and this can increase the risk for PTSD. What they specifically found was that compared to white Americans, older Hispanic adults had worse symptoms like becoming overly sensitive or avoidance or isolating oneself. So far, we've answered two of our questions, what the forms of stress are and how they change over the life. Now we're going to look at how stress can be managed. So beginning in early life, parent-child relationships that are more supportive and nurturing lead to fewer daily stressors for children and adolescents and are also related to less behavior problems. There's also a growing movement to bring traditionally clinical interventions like therapy into the school setting because some research has shown that youth have lower dropout rates for school-based trauma therapy compared to the same therapy used in the clinic. Ongoing stress can also be managed through primary coping or directly managing stress symptoms. For example, learning emotion regulation strategies or trying to solve the problem that is creating the stress is more helpful compared to just avoiding the stressor outright. There's also secondary coping, which involves reappraisal. And this just means trying to look at the situation differently or more positively before reacting to it and becoming stressed. And both the primary and secondary coping approaches help with the negative impact of stress. And this is the case for both youth and adults as well as older adults. We also have psychosocial resources, and these are just the things that people can automatically rely on to deal with stress. So things like our sense of purpose in life, how competent or skillful we feel in our jobs or our social domains, or our sense of personal control. And for middle-aged adults especially, these can buffer emotional distress and protect against depression arising from stressful events. For older adults, they can be enhanced. So these psychosocial resources can be increased through intervention or instruction, and this can help with stress-related depression. There is a wide array of interventions for trauma, the most promising of which is cognitive behavioral therapy, which tries to develop better ways of thinking and managing symptoms of trauma thoughts. CBT has been shown to be the most effective treatment for trauma and PTSD across the life, with even better results when using exposure elements such as facing the fearful situation with guidance. So overall, we learned that event stress evolves from parental divorce in early life to unemployment and divorce in middle life to things like illness and physical impairment in later life. The consequences of these events shift from behavioral and conduct problems to depressive symptoms. Ongoing stress, such as academic failures in childhood to job demands in middle life and health problems in late age, all share the common theme of accumulated or built up wear and tear and well-being. And trauma and PTSD, whether from physical or sexual violence, has devastating consequences and can become especially worse the more chronic or persistent that trauma is. And furthermore, we have to consider the context out of which stress can emerge. So, national, regional, and community factors like recession or drought, and factors like neighborhood crime can maintain or worsen stress, especially for minority individuals or those that live in rural areas. However, we can target these different levels of where stress comes from to address stress management. For example, at the regional level, we can push for policy changes like emotion regulation in the school system. Below that, at the community level, we can advocate for using natural environments or outdoor walking programs, and this can promote community level resilience to stress. And at the individual level, recognizing and promoting the use of coping and social support can equip people with resources to deal with all forms of stress. This is all I have. Thank you so much for your attention.